Warm greetings from the High 10. It is Everyday Shenanigans on this Thursday, April 2nd, 2020. I would like to bring you an update pertaining to the ships that were floating at sea outside of the Florida coast. And this said information is brought to you by the NewYorkTimes.com. Florida moves closer to agreement on sickened cruise ship passengers. The Zaandam cruise ship is approaching Fort Lauderdale hoping to dock, but local officials are reluctant to take the ship's sickened passengers into their crowded hospitals. Okay, this was updated at 3:16 p.m. A little over 3 hours ago. The vacation the passengers had imagined, a luxurious 2-week voyage along the coast of South America to the southernmost tip of the hemisphere, turned into something else entirely. 4 passengers on board died, victims of the coronavirus. Many others began showing flu-like symptoms, with 9 passengers still in the ship hospital. The rest of the passengers from around the world who booked the $3,500 passage on Holland America's Zaandam are stuck in limbo, waiting to find out on Thursday whether the port in Fort Lauderdale, Florida, will allow them to end their horrific, nearly 4-week voyage. Being locked in our cubicle room is definitely having a toll on us, said Robert Rorson, a passenger from Surrey, British Columbia, who was in a 15-foot by 18-foot cabin with no balcony. But with cruise ships widely blamed for spreading an illness, the likes of which have not been experienced in a century, Florida officials weighed the potential consequences as more ships come to port with sick passengers and crew who require hospitalization. Local authorities were concerned that accommodating hundreds of patients from outside their cities could strain resources just when hospitals are experiencing crushing volumes of emergency room patients. The ship arrived 3 miles off the Florida shore early Thursday. Still in international waters, passengers were told to pack and given a health questionnaire. The debate underscores the challenges federal officials in the cruise industry have faced in repatriating thousands of people stranded at sea. We view this as a big problem, and we do not want to see people dumped in southern Florida right now, Governor Ron DeSantis of Florida told Fox News. President Trump has suggested that compassion is in order. They're dying, so we have to do something, and the governor knows that too, Mr. Trump said on Wednesday. We have to help the people. They are in big trouble. Mr. Trump said Canada and the United Kingdom would be arranging flights to retrieve their citizens from the ship, and that others would be sent home. Okay, now I'm going to bring you, I'll wait just a second. I was going to bring you another update, okay. But after hours of debate this week, the sheriff port officials, the Coast Guard, and the Broward County Commission set to determine whether the ship should be allowed to dock still had not reached a decision. Mr. DeSantis said on Wednesday that Florida residents would clearly be accepted, and that he hoped a solution for the others was near. We have people who are very sick on the board, and they need to be in a hospital. But the governor does not want the ship to dock, said Andre Anderson, 62, a passenger from Maineville, Ohio. I want to ask him, how many people have to die on this ship waiting for medical care before he does the right thing and allow us to dock? Michael Udine, a Broward County Commissioner, announced that port authorities had given conditional approval to a plan the cruise line submitted, and the county must now authorize it. The county attorney said no deal has been signed. Kimberly Monroe, a spokeswoman for the commission, said Thursday. The port schedule shows the ship docking at 1 p.m. And here's a tweet from a Michael Udine. Unified Command conference last night and reached condition approval of Carnival's plans, subject to approval between Broward and Carnival. Final document will be released this morning. As of now, ships remain outside U.S. waters. Look forward to seeing a safe plan for all to resolve. And that was this morning at 8:20 a.m. on a social media site. Mrs. Anderson is among the more than 1,200 people who booked trips on the Zaandam, which left Buenos Aires on March 7th. Things quickly went wrong. The World Health Organization declared COVID-19 a pandemic, and Holland America suspended operations. The company expected to disembark its passengers in Chile, but when Chile closed its borders, the ship continued northward. More countries denied it entry. Then passengers and crew started getting sick. Mrs. Anderson has been in her cabin for 10 days now, sharing a single Wi-Fi account with her husband and killing time by making paper airplanes. To limit visits from the ailing crew, passengers have to change their own linens and clean the room themselves. They are not allowed ice. Why, I don't know. Although the illness affected the crew in larger numbers, the employees largely bounced back. Some passengers, most of whom are over the age of 65, did not. On Friday, Holland America announced that 4 people had died on board, 1 each from the United States, Britain, the Netherlands, and Sweden. 2 of the dead tested positive for the coronavirus, said Carnival Corporation, which owns the ship. The ship headed for Florida but stalled for a time as Panama initially denied passage through the Panama Canal. The president of Holland America, Orlando Ashford, wrote an open letter accusing nations of turning their backs on the ship, leaving some 2,500 people stranded. What happens when our supplies run out, he wrote. What happened to compassion and help thy neighbor? More than half the passengers were transferred over the weekend to another vessel, the Rotterdam. The ships have been traveling together to Port Everglades, the port in Broward County, Florida, where they were scheduled to arrive Thursday morning and remain outside U.S. waters while awaiting clearance to enter. William R. Burke, the chief maritime officer of Carnival Corp., Holland America's parent company, said the company brought on a few hundred fast-processing coronavirus tests that have been known to produce false negatives. Even so, 9 of the 11 people the company tested came out positive, he said. The company initially said that nearly 200 people were sick and flu-like symptoms, but later said that figure was cumulative. Just 14 people are ill, Mr. Burke said on Tuesday. Okay. Okay. It still goes on. This is a winded article, I'm sorry. I think there's a possibility they can get better. There are some that could get worse, Mr. Burke told the Broward County Commission. There are 6 doctors and 9 nurses aboard the 2 vessels, Mr. Burke said. We have the right equipment to try to nurse these people back to health. It is our intent to do just that rather than rely on local community unless we get beyond our capability. 2 passengers need to be evacuated immediately, he said, but dozens of people had recovered. A day later, the company said the statement that 45 people were not well enough to travel and would remain on board, and less than 10 required hospitalization. Okay. County commissioners questioned the shifting numbers and pressed Mr. Burke, a former Navy vice admiral, on how he planned to evacuate the passengers without endangering local residents. I have a big trust issue, said Mark D. Bogan, a county commissioner. The coronavirus crisis exploded aboard Carnival's Diamond Princess in Japan, where more than 700 got sick. The Grand Princess had to send its passengers to multiple quarantines around the United States. Carnival evacuated several hundred supposedly healthy Americans and Canadians who were on the Costa Luminosa. Then they flew commercial flights home, and many promptly got sick. At least 1 person died. Carnival has agreed to transfer any passengers evacuated from the Zaandam and the Rotterdam directly to the airport tarmac on sanitized buses. But the authorities rejected an initial plan Carnival submitted that called for some 52 Zaandam passengers to be driven to their homes in Florida and another 200 to fly commercial flights throughout the United States. Wow. Under that plan, the rest would be flown to the West Coast and Europe by charter. More than 100 Australians would fly by private charter to the West Coast and take commercial flights from there, Mr. Burke said. A team of local federal public health, port, and law enforcement authorities advising the commissioners said the company's plan was not sufficient and initially denied permission for the ship to enter U.S. waters. We are the United States of America. We have never turned away people in need or those that are sick, said Gregory Toney, the Broward County Sheriff. But these are very, very critical circumstances. Mr. Udine asked why the matter was not being handled by the federal government. Why is this being hurled on the people with the least amount of ability to solve this, he said. The Coast Guard issued a notice this week that all foreign flag cruise ships carrying more than 50 people must be prepared to care for any sick passengers and crew members at sea for an indefinite period of time or to seek medical assistance from other countries during the coronavirus pandemic. Senator Rick Scott of Florida said that all the passengers should be held in quarantine and tested, but federal health officials stressed that they would no longer be holding cruise ship passengers in quarantine. That was earlier in the pandemic, Dr. Cindy Friedman, a member of the Centers for Disease Control and Prevention's Cruise Ship Task Force, told Broward County commissioners earlier this week. What asymptomatic passengers need, she said, is a mask and to go straight home. The debate infuriated passengers on board. Jesus Christ, people, this is not the Black Death, Charles G. Borg, an 80-year-old retired Dow chemical executive from San Francisco, said in a text message. What kind of fragile people have we become that we can't rise up to the challenge? Local officials have few choices, said Nan H. Rick, a Broward County commissioner. Are we going to let the ship float out to sea and let the people die? Whew, mercy. That is the said information from the New York Times, you guys. And I'm going to scroll back up here to give you some stats. So right now, the ships, as far as I know, are still, I think, 3 miles off the coast of Florida. And I'll bring you the said information as I get it. If Florida is going to allow these passengers off the ship, because there are some passengers from Florida on that ship. Of course, that would be cruel to just take the Floridians off and leave the other ones aboard. But this is a tragic situation going on, and I understand the city of Fort Lauderdale not wanting people to come into the city because naturally they're going to have to get home, those who live in Australia and other places. So that means they have to board an airplane. And now we're talking about getting people more sick because just because somebody doesn't test positive doesn't mean they don't have the virus. I'm going to bring you this said information here with the stats of this article. Latest updates pertaining to the coronavirus outbreak. CDC is expected to advise all Americans to wear cloth masks in public. Trump denounces new House Coronavirus Committee as a witch hunt. Oh, Lord. In just 2 weeks, 10 million U.S. jobs have vanished. And that is the said information. And I will bring you another video pertaining to the unemployment rate at the current moment. But as I state, the ships are in waters considered international waters, which are a couple miles off the coast of Florida. We will see if the Floridians will let the people come in. But there is a fear that more people will become infected with the coronavirus. I understand that, but I also know you can't just leave the people out there floating on the water. That is cruel. And you don't want more people getting ill on the ship because that is a probability, whether they test positive or not. This should be a national situation for help. If the city don't have the resources and or the state don't have the resources, then that's where the national government has to come in. And I understand at this moment the national government is probably boggled down with a lot of financial burdens at this current moment. But as you see, our country was not equipped for any type of disaster of this magnitude. As you see, people are without work. People cannot get through the lines to the unemployment offices in their states, their local cities. So this is a major problem. So now you count people can't get through to the unemployment, then that means they can't sign up for unemployment until they get the lines up and running and adequate to serve all the people applying. Then you've got numerous people sick. Then you got crazy people in hospitals, such as an area near me in Hawkins County, don't want the staff to be tested if they're asymptom, which is stupid. Why would you not want to test people? They're working around people who are sick, who've tested positive, but you're saying, well, you look well, you say you well, come on back to work, or stay on at home, and stupid. Just like the situation here. These people need to be quarantined, yes, and they need to be tested. Why would you let these people get on airplanes amongst other citizens and not know if they have the virus? That would be irresponsible. And that would be taking the coward's way out to say, well, we don't got the funds, we don't got this. I don't care. We'll get them off the boat. We'll ship them on where they need to go. But that's it. They're on their own. If they get sick, then they'll handle their sickness over in their city, town, country, whichsoever. Which I understand the flip side of them staying here being quarantined, you have to have somewhere to quarantine them. You have to have adequate resources, medical staff, medical equipment, a facility to hold them. I get all of that. But see, this goes back to what I said. America is not equipped for these type of scenarios, because it's one thing to have tornadoes, hurricanes, things like that, floods. You have to wait on the government, city, states to come in and help, send in doctors, send in volunteers. That's a burden as well. But this is an invisible ghost running around, entity, jumping from person to person. And you can't see it. You understand what I'm saying? And that's where the problem comes in. You're walking around looking happy, feeling good, but really you're sick and don't know it. And as I've stated, we don't know the incubation period of this coronavirus. This is a serious situation. It will affect us personally, mentally, physically, our economy, because people still have to be able to move about to get us things to the store so we can still eat, get our medicine, toiletries. You don't stop living because somebody says you need to stay in the house. You still got to bathe, still need soap, toilet paper, all the basic food. This is a bad situation. And all I can think to do is pray. And pray for those who are out here in the world helping assist us and keep us afloat. So I'm not going to knock the government just as yet. I'm just going to wait and see what happens. I'm going to wait to see what our local officials do. Because right now this isn't the time to overreact and start flipping out. Because this is when you'll start acting like a fool. You understand what I'm saying? But we are in dire straits. And many people are going to suffer because many people are going to get sick. Many people are going to die. And then it becomes a burden on people's families, having to bury them. Funeral homes get overloaded with sick people. See, people don't really think about the dynamics of death and people not working and people being without a job. Then that means no money. Now you can't even call to get unemployment because the lines are messed up because they weren't preparing for this many people to be applying for unemployment. We as a nation are going to have to do better. The officials who are over certain things such as this, unemployment, national disasters, they need to have a plan already in motion. They need to have doctors, scientists on board in case there is another outbreak for the next one, because you surely know there will be another one. Especially when you have unsafe practices dealing with meat products, wild animals, and the human. I'm praying for all of you. I'm praying for these people aboard these ships down in Florida. I'm praying that they get off the ship, they get quarantined, they get medical help, and then once they get the okay from the officials that they can leave and go home, they make it safely home. God bless all of you. Like, share, subscribe. Drop your comments below. And let's stay vigilant. And let's keep our distance, keep our hands washed, and pray. God bless you, and thanks for listening. This is Everyday Shenanigans. Bye-bye.